Hi, everyone, and a really warm welcome to today's EMIC webinar. For those of you who don't know me, my name is Fiona Costello, and I'm so glad you could join us for today's fireside chat. From isolation to inclusion, leveraging digital mental health innovations to end stigma and cultivate a future of acceptance. Today's topic sits at the heart of all we do. It's the ongoing work of breaking down stigma and creating a world where individuals feel empowered to speak their truth, talk about their mental health challenges just as openly as they would with their physical health, and reach out for support when they need it. We're thrilled to have two world leaders in this space with us here today. They'll explore practical ideas and proven solutions from years of experience at the intersection of digital innovation, national public campaigns, research, and community building with governments, global bodies, NGOs, funders, researchers, and lived experience networks. You will hear from our wonderful speakers very soon, but first, as always, I just have a few quick things to mention. Firstly, feel free to share your current location or area of interest. To do so, you can click on the three dots next to your name tag, choose Edit, and add your country or area. This allows you to connect with others who share similar interests. If you have any questions for the panelists during the webinar, which I'm sure you will, please feel free to post them in the Q&A box. During the Q&A session, I will do my best to include as many of them as possible in our discussion. We always like to prioritize your questions, so please do make sure that you use the Q&A box. And lastly, today's webinar is being recorded, and the EMIC team will soon share the recording in the Knowledge Bank. Now, it gives me great pleasure to introduce our first presenter, John Salmon. John is an award-winning social impact innovator, entrepreneur, and mental health campaigner with over 25 years' experience in digital innovation, mental health, and community building. He co-founded social impact agency Bytes Entertainment and the lived experience-led Speakers Collective, supporting over 200 speakers to drive change through education, storytelling, and advocacy. With more than a decade designing campaigns and community strategies addressing isolation, bereavement, youth mental health, and local empowerment, John has partnered with organisations from FIFA and the Royal Foundation to NHS England and grassroots movements. A dyslexic thinker, he openly shares his lived experiences, including being sectioned and losing his father to suicide, and champions neurodivergence. John is committed to ending stigma and promoting inclusion through media, digital innovation, and collaborative campaigns with communities, corporates, and philanthropists. We all can't wait to hear from you, John. The stage is all yours.
Thank you, Fiona. It's lovely to be here today. And yeah, let me see if I can share my slides. Okay, always the first test of doing online events. So yeah, welcome everybody. It's great to see so many people here today. So I'll be briefly giving a bit of background about myself and some of the projects that I've been working on. I'm the co-founder of a social impact agency called Byte Entertainment, the co-CEO of Speakers Collective, which is a lived experience community of over 200 amazing individuals. I'll come on to talk about that a little bit more in a bit. But really, I think kind of to kick off what is such an important conversation around stigma and discrimination is that I wanted to share a bit of my story to give a bit of context and how that has also led into the work that I now do today. Um, I'm very aware of the things that I share, and but I will be discussing around kind of mental illness and touching on suicide. So just to be mindful about some of the things that I'll be discussing. But I think it is really important that we start to have these conversations more, and so that people can reach out and get the help that they need. Something I know that's going to come up a number of times through today's talk is around stigma and discrimination being worse than the impact of mental health condition itself. I know this personally, that how that stigma has stopped me getting help. And this was what kind of the main conclusion that the Lancet's Commission came to in 2022. So if we go back a little bit in time to 2016, and this is my friend John and his sister Michelle. Michelle was also a very good friend of mine. And very sadly, I got the call from John to say that Michelle had sadly died to postnatal depression. Unbeknown to me, everything from social media implied that everything was okay, but it obviously wasn't. And sadly, yeah, Michelle wasn't able to get the help that she needed. And that made me obviously incredibly sad, but also it made me really angry that in, you know, 2016, people were still struggling and being able to ask for help. And I wanted to do something, and something that's really helped my mental health over the years is been running and getting and doing some activity and health. And around that time, I went googling, looking for a challenge to do, and I came across an organisation called the Heads Together. And this was, I think, a groundbreaking initiative back in 2017 where actually it brought together a number of mental health charities in the UK to actually come together with a clear message that we all have mental health. So if the campaign just did one thing, it was really trying to destigmatize people talking about mental health and mental illness. So I found this campaign and I saw that they were connected with the London Marathon, and I signed up for a charity that was part of Heads Together called Best Beginnings, and they were a charity supporting first-time parents predominantly with digital tools, and my background's also in digital and video, and they really embraced that as a form of with a baby buddy app to get digital help into people's hands. So I love that charity and I got set up ready to run the marathon. And I got a call and was asked if I was available to do a talk with a friend to share my mental health story. I'd never really sat down and thought about my story before, and it was actually while I was away for work, kind of through the night, I wrote out my story for the first time because they'd asked me to kind of send them a bit more detail. And when I did that, I'd say it was a very cathartic process going through it. But also when I read it back, I was like, oh my goodness, John, there was some real tough times there that you didn't ask for help. And then what could have been different if you had done. So anyway, I wrote that down. I sent it off. And then a week later, what I initially thought was going to be a very small conversation with a group of people, um, I got start of wind that actually this would be slightly bigger than it was in my head. And this is a picture. You may recognize a few faces there. In the background, the guy with the beard is my friend Steve, who supported me when I was having my own mental health challenges. Don't think the other people on screen need any introductions. But this was a very important day for me. It was the first time I talked publicly about my own mental health journey. And I guess from going from 0 to 100, this was not always the best way to do it, I guess. And so I did a lot of live um, media on that day and shared some things that not many people knew about my past. And even when the campaign continued on, I was in a relay race in some very surreal moments, plonked in amongst celebrities and yeah, invited to some interesting meetings as well. I was running the London Marathon. There's obviously more that I could go on talking about how that running that with John, who also decided to run in memory of his sister on that day, was not just a physical, but obviously a mental um, barriers of getting through and to get to that finish line. But it was something that we were so proud of that we were able to do that together. And Sue will no doubt talk about time to change within her section of um, today's webinar. And I was very proud to become a time to change champion. There was an initiative that actually been running long before the Heads Together campaign started to really work around ending mental health discrimination. And I was a very proud champion of that campaign. And I'm sure we'll get on to talk a little bit more about the work that achieved with Sue later. So, to give you a little bit of background about my own mental health journey, I was born in 1977. You can start to do the maths. I can't do the maths now. And running, between those times, I grew up in England in a county called Hertfordshire, and I've got two older brothers. And yeah, life was growing up for me was good. And this is my dad, Peter. This is a little me, I think, in our first a holiday abroad in France. And my dad was an inventor. He invented some of the first underwater housings for video cameras and stills cameras that were used on documentaries. Um, his business ended up having to close during the recession in the 80s and 90s, and that was something he really struggled with. He did get back into work, but the dad that I knew that had been really outgoing, a governor, had his own business, started to become more withdrawn and depressed, and that was very difficult to deal with as a teenager as well. Um, this is the local hospital to where we lived, and he was admitted there after attempting a number of times to take his life. And sadly, a number of months later of that year, my dad did die by suicide. And as a family, we obviously kind of came together to try and support each other, but we didn't reach out for any help. I didn't get any professional help or support at the time. And so, really, between the period of coming up just before the millennium, I'd done the great job of just burying all of that emotion. And I was able to get to university. What was really strange, I'm not incredibly academic, as Fiona mentioned at the start, I'm dyslexic, and I'd kind of struggled with education over the years. But during that period that my dad had been ill, I'd actually really focused on my education and was able to get to university. So this is Bournemouth in England, which I recommend if you ever need a break by the sea. I got my first job working at America Online. This is what the internet used to look like. It's something I wish that it looked like now. It was a lot simpler back then, incredibly slow. We obviously wouldn't be able to be doing events like today. Um, but during that first proper job, I guess I had, there was a lot of stress within that role. I wasn't asking for help. It was a dot-com boom, so there was lots of parties, working weekends. And on the 7th of December in 1999, I woke up um, really, really panicked and scared. And this picture here really goes to kind of demonstrate like the emotions and feelings that I felt on that morning when I woke up. I was incredibly paranoid. I remember looking out the window and thinking people were watching me. Luckily, I was able to phone my brother. But it wasn't long before I was back in the hospital that only a few years ago that I'd been visiting my dad. And yeah, had this sense of life kind of repeating itself a bit. I was sectioned under the Mental Health Act. So really that just meant that, yeah, I had to stay in hospital until the doctors felt that I was well enough to leave. Um, it's not probably just your screen that you can't read the notes here. I think I struggle to read these notes. What really this care program and details here was saying that I'd had a brief psychotic episode brought on by stress and depression. And yeah, it was a rough ride. I did come out of hospital and end up going back in again. It was actually through my employer that we finally found out that we had private medical health insurance, and that gave me access to CBT groups and different activities that slowly got me back into work. But I was off work for over a year. And coming back, I guess, to that key message around stigma and discrimination and what the campaigns that I've been involved in, it's it's still really quite basic where we're still now, even in 2025, the stigma and discrimination that exists around mental health and around mental illness. If we can just get a space in different places where we can feel more comfortable about talking about our mental health would make a massive, massive difference. Some different stats around 1 in 4 of us will suffer from at least one diagnosable mental health problem in any given year. I think during periods of COVID, more and more people have experienced anxiety and depression, and it can be really difficult sometimes knowing where to get help. Some of the work that I do is also making sure that, and through our members at Speakers Collective, is that we start to promote where you can get help. This is very specific to the UK, some of the signposting here. So we've got organisations like the Samaritans, which you can phone, or Shout that you can text. Another amazing innovative digital service in the UK is the Hub of Hope, which has become the largest directory for mental health services in the UK. And so I definitely recommend having a look at that with regards to a digital service that will be of interest to find local support where you are. But really, that kind of important thing about if you need mental health support, you need to speak to somebody. It could be a friend like my friend Steve, who I initially talked to, getting more professional help, or a doctor. But also, if you're worried about somebody or yourself, in a crisis, it is dialing and the number for emergency services. So as I just finish up kind of my section of the talk, um, I wanted to just give like 3 examples of digital mental health innovations that I've been working on as a part of my work that's hopefully trying to end that stigma and create a more accepting society. So with campaigns like Heads Together and some amazing work that Time to Change had done, really learnt about the important power of community and bringing people together. And Speakers Collective has set up as a not-for-profit to challenge stigma, facilitate important conversations, and promote learning on a number of social issues. And what started out as a small group of people talking about mental health in 2018 has now grown to over 200 members around the world talking about not just mental health, but physical health, race, you name it. We've got an amazing group and growing group of individuals that share their lived experience to challenge stigma and discrimination. We have digital communities by meeting up on the first Thursday, online kind of meetups and different specialist interest groups. And we also provide lived experience speakers within healthcare, charity settings, small businesses, whether it's talks, workshops, or campaign support. And yeah, really proud of the work that Speakers Collective is doing. And I'm proud to be the co-CEO of Speakers Collective along with Joe Emerson. And while digital experiences are really brilliant at bringing us together, I think kind of how we start to look at how we blend these spaces is really important. Local to me in London, we've set up a community space called the Snug, and this is a lovely space where you can do simple activities, creative activities of arts and breathwork sessions, or just even pop in for tea and toast. And this is really aimed at people with more moderate to severe mental health problems or severe kind of to moderate isolation within the community. And that's been running for about 2 years now, and has made a dramatic difference and a preventative difference. But also we've done digital workshops in there, and getting people the experience and being able to access different resources. Then the final project is something very exciting that's hopefully going to be launching later this year. So through Byte Entertainment, we've been working with NHS England to create a suicide prevention digital training resource. So it's about 40 minutes worth of material that will be on the NHS Learning Hub, aimed at healthcare professionals around suicide prevention. I've been really honoured to work with Angela Samata and Jane Boland, who have co-written the Zero Suicide Prevention training, which some of you may be aware of and completed. And so we can maybe touch on a little bit more about that in our conversation later, about how that training and everything was really co-designed with NHS professionals and the focus groups that we've done. So yeah, the final message, I guess, that I want to leave you for my presentation is that, you know, it's so important that you look after your own mental health. Exercise has really helped me. Sometimes just going out and buying a coffee, but you know, please do, if you're watching this today, do something nice for yourself. And if you are struggling, there is absolutely no shame whatsoever asking for help, and it's the first step to hopefully getting the right help. And have a conversation. You know, be aware if somebody's not um, acting like they are. Maybe they haven't responded to texts, or so. You know, check in, um, and just asking you're okay and listening could really save a life. So, thank you so much for listening. I'm going to hopefully stop sharing my screen, and I look forward to asking some questions later on.
Thank you so much, John, and thank you so much for sharing your story and for showcasing some of these incredible and amazing initiatives. Yeah, it's prompted a lot of questions from me, but sincere thank you for sharing that story. We'll obviously bring you back on for questions shortly, but now I would like to introduce the incredible Sue Baker to join us. Some of you may have met Sue at Congress last year. Sue is a global leader in mental health campaigning and anti stigma work with extensive experience, influence, and networks across governments, NGOs, funders, researchers, and lived experience networks. She is the founding director of the Time to Change and Time to Change global programs at Mind and has over 30 years' experience in the NGO sector. Through her global consultancy, Sue provides evidence-based approaches to tackling stigma and discrimination, marketing strategies, and management consultancy and coaching across sectors. She is passionate about partnering with people with lived experience and policy leaders to transform how societies approach mental health through behaviour change and lived experience leadership. The Changing Minds Globally team currently operate across Africa, the Caribbean, Lithuania, the Falkland Islands, Europe, and beyond. Welcome, Sue. It's so lovely to have you with us. Over to you.
Thanks, Fiona, and thank you so much for the opportunity to spend some time together. And John, wow, that was amazing. Hard to follow that act. But without people like John, the Time to Change campaigns just wouldn't have achieved anywhere near what was achieved. It was a collective movement. And having those of us with lived experience, I'm one of them, driving it, designing it, evaluating it, governing it, and most importantly, thousands of people supported and peer supported to share our lived experiences to tackle stigma. That's essential, and John was a very key part of that. So John, thank you for everything you've done, and thank you for sharing your journey as well. That was really quite emotional. So let me I hope I can do what John did. I'm really rubbish with IT, and share my slides. Yes, let's see if these are working. And can you see that? I'm hoping you can see that. It doesn't need to be full screen, probably. I'm not sure what you can see, but I'm hoping you can see that, even if, let me see if I can, there we go, I can increase it a bit. There we go. Sorry if it's not full screen, it doesn't seem to be playing ball. There we are, right, full screen. So just a quick overview. There's a lot of information in here, some of which I presented to the EMIC Congress in Ottawa last September. I've updated it a little bit, and things have changed a little since I was last talking about digital interventions to help address deeply ingrained stigma and discrimination, which sadly, just as mental health issues are common across our cultures and contexts, so are stigma and discrimination. So I've had the great privilege of being able to work with people with lived experience, NGOs, policymakers, funders, key stakeholders, global stakeholders, to adapt evidence-based approaches with local NGOs and people with lived experience. And Fiona kindly mentioned some of that. But each and every time, often what you find is stigma and discrimination thrive when knowledge and information is absent. So often mental health is not in school curriculums, it's not a topic of conversation or support or education in workplaces. Communities don't talk about it. Shame is common. Stereotypes are common and myths, where quite often when we do focus groups before even a program and a campaign get designed, you sit down with your public audiences, segments of them. And often what I hear is, without that information and education and people openly sharing their lived experience, those myths and stereotypes thrive. So they thrive in the absence of information and education. So often what people understand to be mental health is simply the end of the spectrum where people are in crisis. And I hear phrases all over the world, in Africa, in Asia, in the Caribbean, all over the place, in Europe, where people just think about people being a danger to others, throwing sticks or stones, or living in rags on the streets. And no one judges that, but that's people's only concept of mental health, is very extreme mental ill health when people are in crisis and not receiving appropriate support. So there's a huge amount of work to do. So today I'm just going to give a little bit of strategic background to why it's so important to address stigma and discrimination, and how, as Fiona, you quite rightly said, it's such an overarching issue in our world. A little bit of information shared from the brilliant Lancet review, which I was lucky to be part of. There's now a toolkit from the World Health Organization that I was lucky to be part of. I'll share all these links at the end, and my slides will have links in them as well. Talk about some of the evidence-based approaches and digital strategies as part of that. And then some thoughts around limitations, challenges, and opportunities, because as with anything else, there's pros and cons to this work. So let's see. Oh, brilliant. Even the slides are moving for me. That's great. So I think we all see stigma and discrimination as a kind of shadow, but it is a major cloud that overhangs and has a negative impact on everything in the mental health field and associated fields beyond that. And more importantly, those of us with lived experience of mental health problems. So if you've got social norms that are fueling stigma, prejudice, misunderstanding, and negative behaviour, which is discrimination, that will impact your ability to transform services. It will impact policy and legal reforms. It will impact mental health promotion and prevention work, suicide prevention work. It will reduce earlier help seeking and early interventions. And it will undermine people's ability to sustain recovery and to maintain treatment gains, if you want to talk about it like that. Because we're not just a set of symptoms, and it's not all about help and support and services. You know, you'll be ping-ponging in and out of services if you can't maintain relationships or gain them with friends or partners or family members because of stigma and discrimination. If you can't get a job, if you can't stay or enter education, if you can't join social clubs, you know, the list goes on. And that's why we say stigma and discrimination are a major barrier to human rights. Our rights to employment, education, income, relationships, social connections. So that's why I talk about it as the big barrier. And if you are simply improving services but not doing anything about societal stigma and discrimination, you're only doing part of the job, I'm afraid. The two need to go hand in hand. It's not stigma work or services, it should be both. And tackling mental health stigma, as we found in England, it doesn't mean that things haven't shifted back a bit more recently, but we had huge political will that we fought hard to gain across the Time to Change partners and Mind and Rethink and all of our colleagues in the sector. And we did have political support. At one point in a previous election, I think 2 elections ago, there were more mental health mentions than any other health issue in the major party manifestos. Who would have imagined that 20 years ago? So why stigma and discrimination? I'm conscious of time and I'm whipping through, but the World Health Organization has its mental health action plan. This is just one reference point, by the way, which has been extended to 2030. In it, you can see that one of the objectives is to implement strategies for promotion and prevention of mental health. That, to me, isn't specific enough around stigma and discrimination. So, therefore, pulled out of the detail of the report as one of the proposed actions is about multi-sectoral strategies that combine universal and targeted interventions for promoting mental health, preventing mental health disorders, for reducing stigmatisation, discrimination, and human rights violations. So you are meeting international mental health action plans and policies, let alone what your national action plans are in each country. And if your mental health strategy doesn't address stigma and discrimination, it's got a major yawning gap in it, and that will limit its success. So just to go back, John kindly mentioned this, the Lancet Commission, which is kind of the major tome, the major Quran or Bible on evidence-based approaches to address stigma and discrimination. It came out in 2022. It's the biggest review, it's a big umbrella review of major academic peer review papers. And it also did a survey of people with lived experience across the world. But I've put a link to it at the end of my slide, so I won't go on too much. I've got a couple of slides to share. But here's the evidence that stigma and discrimination contravene basic human rights and have severe toxic effects on people with mental health conditions that exacerbate marginalisation and social exclusion. And the global survey found that the vast majority of people said that, with lived experience, said that stigma and discrimination can be as worse or as bad as the mental health problem itself, just like John referenced earlier. We found the same in Time to Change. We did a big survey of about 1,000 people using secondary mental health services across 5 mental health trusts in England. 88% said they experienced discrimination, and I think the average was 5 areas of life were affected. So this was sort of a few years into Time to Change. And that was the big outcome that we were seeking to improve, as well as public attitudes. It was actual behaviour change and reductions in discrimination. And I'll come on to what we achieved in a second. Again, 2/3 of people said that stigma was as bad as worse than the mental health problems itself. And sadly, many people, because of stigma and discrimination, had wanted to give up on life, and that is horrifically tragic. Just to go back to the Lancet again, it's very helpfully set out 4 types of mental health stigma. So self-stigma, where we internalise that external shame and judgment. Stigma by association or affiliate stigma, so stigma that affects your family, people working in the sector. Public stigma, so those 3 scales that we used for the evaluation of Time to Change, they're they're validated across global regions, so knowledge, attitudes and behaviour. We have 3 tools to measure that. And structural discrimination in policies, practice and legal frameworks. And the Commission had 3 core findings. The first one I've just shared about the toxic consequences of stigma and discrimination. The second one, which we've known about for quite some time and tested and implemented this, not just in England, but now across global regions where I've worked with local colleagues on stigma and discrimination. The most evidence-based approach is social contact between those of us who have mental health experiences and those who do not. There are many conditions needed for that to be effective, lots of learning across cultures and contexts that are shared in the WHO Stigma Toolkit and in the Lancet Commission report. And the third really important finding is that those of us with lived experience must be empowered and supported to play active roles in stigma and discrimination efforts. There's a lot more from that report as well. So just to share some of the evidence-based approaches before I talk about stigma strategies. So what I've been doing since Time to Change, so for 4 or 5 years, I've been a consultant now working with partners and organisations and with lived experience around the world, is adapting these core methods and evidence-based approaches. So foundational research is needed. So what's existing data on attitudes, what are your baselines going to be, and discrimination, of course. Research with potential future target audiences. What do the public think? Why do they think that? And what are the opportunities to create empathy and change so that they are creating the campaign strategies with you? Lived experience champions, ambassadors, leaders, social contact events, social marketing. That was a huge part of our programme. I'll share a little bit of that in a minute. Excuse me. And lived experience leadership, absolutely evaluation, not just at baseline and end, but at regular intervals, so that you're constantly learning what's working, what's not, what do you need to tweak, do audiences need to change, do interventions need to change, what's showing the most promise and impact. And here are some of the papers. these links are all on my Change Your Mind Globally website. So if you Google that, some of these, actually all of these papers, I think, are on the website. So what happened? We had a 12.7%, I'm conscious of time, I'm going to whip through, improvement in public attitudes, a 15% decrease in average levels of discrimination. It went from 32 way down. I won't talk about that till the cows come home, but that for me was the litmus test of whether our lives had got better or not. People who, like John, who were trained and supported champions, feeling more confident to address stigma and discrimination. And importantly, that fourth point, that people that were aware of the Time to Change campaign, could recall it, had greater levels of comfort in disclosing a mental health problem, intended help seeking as a paper that's published, and very, very significant improvements in local and national print media coverage, but also broadcast coverage, because it used to be stigmatizing, anti-stigmatizing coverage, then it went to about there, then it went to there. So we've seen a very big shift, and we had a very big piece of work. We worked with on about 80 TV and radio scripts a year, worked with all the major print media and social media as well. Oh, sorry, that's help seeking. I'll whip past that one. So just to come on to digital strategies, just sharing a few of these just for a couple of minutes. There is evidence, which I'll show in a minute, which I still think the jury is out, with more research needed, but the online social contact, where you're having a two-way conversation with somebody with lived experience. It's called indirect social contact. Sometimes that can be pre-filmed. Apparently that has good results, but let's see if there can be more research into that. But that can be as powerful as meeting somebody in person at one of our many events that we held and that people hold around the world, marketplaces or bus stops or temples or football matches or sports grounds, or in workplaces or schools. Online self-directed training for people with lived experience. I'd love to see more of that. I'd love to see that available and contextualized across the world. We did some of that for champions, but at Time to Change, we had modules for safely and effectively sharing your lived experience. I think that's definitely something I'd like to see happen. Peer learning webinars, virtual conferences like this, training for target audiences and digital simulations, where we train GPs, we train mental health professionals. What I've really seen really powerfully support those of us with lived experiences, train champions having their own WhatsApp group, their own sort of peer network, like John's organisation. There's a great one in Australia that Batir have called The Herd, because they talk about the elephant in the room, and that's their identity. I'll come on to that. Storytelling apps. They have a storytelling app where you can download the app and you hear people with lived experience sharing their stories to break down stigma, but to help as well. And they've had great results with people feeling less self-stigma from being part of that experience, and mental health literacy going up. I think there's a paper about to publish. Obviously, paid for space. We used a lot of social media, especially in the last 10 years of Time to Change. It was a huge organic social movement that had great power, where, literally there were many, like 250,000 campaigners in our movement, and they had really positive achievements. Podcasts, social listening tools, Google Trends, that's the way of finding out how your populations are talking about mental health online, and your language needs to reflect that. Chatbots, generative AI, research and evaluation can be done as well. So just briefly to say, where I said the jury was out about social contact and it being online, so indirect, I worked on this report, I think, can you see it? Probably not very well, with colleagues, Graham Thornikoff, Petra and Claire Henderson, for the World Bank for a global summit on stigma last year. And that was a further latest review following the Lancet Commission in 2022, so it reviewed any published data since then. And it did find that 2 reviews that focused on digital interventions around social contact. One was to increase help seeking, and one was focused on sort of augmented and virtual reality with virtual interactions and characters and environments to sort of experience mental health symptoms, I guess. And it did find that they improved knowledge, attitudes and empathy and reduced stigma. However, what was noted was that there wasn't a control of comparing that to face-to-face social contact. So it's good to have seen those results. I think that shows promise, but I think a bit more research is needed to see whether it's as powerful. So that's how we've used social media in campaigns in Ukraine, Ghana, Kenya, the British Virgin Islands. And I'm going to have to finish in a minute. These were organic movements. They were huge. We challenged two big retailers when they did stigmatizing costumes for Halloween. And that was our movement that started that and led to this big win. And some examples of digital tools, as I said, podcasts, Batia's Being Heard app, their fantastic Australian mental health organisation, and Storytelling Camp. We did that online as well. And just some thoughts on limitations. Obviously, inclusivity is always an issue working digitally, having more of a focus on seldom heard or marginalised communities, making sure that what you're sharing is done safely and effectively, that moderation is there and support people with lived experience. And yeah, I think there's a great future. I think the stigma field is slightly behind, well, way behind the services field in embracing opportunities to use digital to create change. So I'd love to see more conversations. And here at the end are links, if you want the slides, to the various different toolkits. And there's two global learning networks that I'm a co-chair of, both the Global Anti-Stigma Alliance and nearly 700 people in the GMAN Stigma and Discrimination Working Group. And if you want to chat more, I'm on LinkedIn, a bit on Twitter, but yeah, and can email. Thank you so much. Sorry for going over.
No problem at all, Sue. Thank you. I think it's indicative of there is so much to say about stigma and discrimination, and I think all of the information that you and John have shared is super important. So thank you. John, if you want to come back and we can start the panel. Before we jump into the discussion, a quick reminder to our audience. I can see a couple of you writing questions in the Q&A box, which is where I'm going to start, just conscious of time. Please post your questions in the chat and I'll do my best to bring them into the conversation. I guess one of the things that I wanted to quickly reflect on, just in direct response to your presentations, John, so I want to go back to the Time to Change campaigns and the Heads Together campaigns, because I remember them a lot and it really felt like a movement. It really felt like a seminal change. But I also reflect what you've said, John, which is that it's 2025, there's not enough. But in terms of your reflection, John, of going from 0 to 100, as more people turn to digital to share their stories and seek that social connection, I'm struck by how we can ensure the right support for individuals sharing their stories, and what kind of considerations do we need to make in the context of digital, because it can be a difficult process to go through. And obviously it does feel like that presents some risk if then someone is behind a laptop or behind a screen. So I was just curious about your reflections on that from both of you.
Yeah, great question. I think what Time to Change was incredibly good at was the training and support that was put in place for people that wanted to share their lived experience. So that was done by a mixture of in-person training, and also there was some different online training materials as well. For me, when I shared my story the first time, even though it was literally from zero, I shared things that day that, just even mentioning the word mental health or mental illness or suicide, and here was I saying these words on live TV, and I then had to leg it home to pick up my kids from nursery that same day and feel this massive weight off my shoulders. But also my phone just started to ping with messages, and from people I knew and I didn't know. And I was sharing what I shared from, I'd say I had 2 feet quite solidly on the ground. I was in a good space mentally. I was, I knew roughly what I was doing, when I was taking that. But I think kind of through the work doing with Speakers Collective, carrying on the baton from really what Time to Change was doing, was really that we were seeing other people through our early days of Speakers Collective, which was just a very informal group where people were sharing their lived experience, where they were still probably quite unwell. And even though that was helpful, they weren't getting the right kind of support in place. And then that's the problem when anybody's trying to challenge stigma or discrimination. You're usually coming from a space where it's not level and you're probably down here, and that is always the big struggle with people that are doing amazing work, sharing their lived experiences. That there's a lack of support there. So I don't know, Sue, if you wanted to come in on that, but it's a big one.
Yeah, I mean, whenever we, excuse me, train people to share their lived experience, well, we train people in two ways. Part of the training for people with lived experience is about preparing to consider what you do share. There's something that we do in the training that we do with partners around the world, and I have two ex-champions that were coordinators that train people in time to change, Dane and Darren, and they're great. And as part of the training, we give people back the control about how much of the story they share. So I think because of time, I'll just explain it we get a page out. We did this in Africa, in India, in the Falklands, the Caribbean, Lithuania, and you draw a line. And part of the training, this is only one small part of it, is above the line, you put what you're willing currently to share about your lived experience of mental health issues. And below the line, you consider maybe what you're not ready to share, or what you will never share. And you then decide how much of your story that you tell. And we warn people, however, that once you've shared above the line, you can rarely take that back. So think carefully. But if there's stuff below the line, that line might change. You might draw the line and share a bit more over time. John, you went head first in, and that must have been such an emotional roller coaster. And then people pinging you, and I know what it's like when you've done a big bit of media work. I remember saying on Breakfast News, it's the first time I said, "Oh, and I thought about suicide," when I was working with the Archbishop's daughter, and we did a long piece, and they were inundated, more responses from viewers than ever before, and it popped out of my head, and I could hear their producer saying, "Oh my God, she's just..." But it has a big impact, doesn't it, on the audience, on yourself, on the people that you love. I was like, gosh, I'd better just give my mum a ring. I don't think she knew about that. And these are, and you get back to daily life. So we help people in the aftermath of sharing the stories. So that's what we always say. You can't just put people out there. You need a paid coordinator who often has lived experience as well to support a team of ambassadors and champions. So we always say that, and that's ongoing support, because what we found was that after 4 social contact events, people's confidence and self-esteem went up. But it took a bit of practice, and we can all have bad days, and there are times when you think, oh God, I'm up to that, or you really need your peers around you. So no one ever does it on their own. You have to do it at least in pairs, to support each other. And I think the other thing we did was it's safe and effective. Like, you've got to be trained in how to deliver social contact interventions and conversations, because it is a certain method of doing it. It's not standing on a platform in front of 10,000 people or being part of a play or a show. It is interactive, one to two, where they can ask questions, you can ask of them. And it's an equal, you're on an equal playing field. So it's really important it's done properly, and anything online is properly moderated. People are putting very sensitive information out there, and we all know that there are a lot of keyboard warriors. So you have to moderate. You have to make sure when people are sharing online, as part of your online campaigns, like those posts I shared of champions across the world, we have to make sure those campaigns are well moderated, because people will have their own socials.
But I think it goes to impress the importance of making sure that there are appropriate guardrails for the development of these digital tools to reflect what you've just described, Sue and John, but also to make sure that there is a space where people can access those kinds of technologies and the resources that you've shared, so that those that have taken the time to really understand that nuance and really understand the impact of sharing your story. I just want to go to one of the audience question, because I think it's quite relevant for this. And time to change is good and well, but what if general family and other generational stigma of not understanding what mental health means for them, not only as a family, but the family who is dealing with it too? And I mean, I'm speaking for Tanya, but it's hard, isn't it? It's hard when you share your story and you may be in a position where you feel you've got to a point where you want to share your story, but there is definitely an impact to your family and your loved ones. You mentioned your mum, Sue, about not being aware. Is there is there a best in class approach for that? Is there a sort of a digital kind of element to that as well? It'd be really interesting to get your thoughts on that.
I think just from our perspective, so I talked about that baseline and ongoing annual evaluation of that outcome around discrimination. Well, so talking about within the family and generational, the most common area, and I find this around the world when we go into research with people with lived experience where stigma and discrimination are coming from, is family and friends. So
Mm,
family, friends, workplaces, communities, is always family and friends first. And there was somebody very well known who I won't mention in the mental health sector in England who said to us, and we went to see him about the plans for Time to Change before we even launched an actual social marketing campaign, said you'll never change the dynamics between families. He said, well, we're going to have to, because this is the most common area. And what we found was we came up with this methodology of subconscious stigmatizers, conscious stigmatizers, and active discriminators. So the vast majority of people were subconscious stigmatizers that were saying and doing the wrong thing because they didn't know any better. None of us had been taught, like I said earlier, didn't know how to talk about it, didn't know how to react, didn't know the way they could be more supportive. So subconsciously, all that negative behavior was coming, and that's where we saw most change. So you can change the dynamics between a family. But you sharing your story might be one way, but also seeing a campaign at the same time with other people sharing it as well helps you not feel alone, and your family
mm,
will learn from that campaign as well. So
mm,
it's hard when you're doing it alone. When you're doing it as part of a big movement or a campaign, or John, as part of your organization, then you're not singled out and you're not the only one doing it. And you can work between generations. I mean, of course you can. And we had a big focus on men and younger people as well as the general population. So I would say digitally, again, speaking out individually, we want anyone and everyone to feel they can do that. But if you're doing it as part of a wider movement, I think that helps. And I would definitely do it with some backup, or at least someone that can help you prepare. Because going out
Yeah, just
with a story is a big one, isn't it, John?
yeah, just echo that really about the power, even if it's the power of two, sometimes something that I've learned about just not doing it on your own. And even in sometimes that other person, even if they're just a bit of a support, just to like, yeah, you've got this, John, or keep going. Um, yeah, doing things on your own is really tough, especially in this space. So yeah, I've echo exactly about creating collectives, creating groups, support around there. Just to kind of touch on the family side of back to your point, Fiona, was what made me decide to share my story was my family, and that was my family. I've got two young kids, and so family is encompassing, isn't it? It's it's my dad, it's my mum, it's my brothers, but actually I knew that I didn't want my two kids to be growing up where they couldn't talk about these things. So yeah, for my mum, that's going to be really difficult, for her to talk. And so, but the younger you are, and the if stigma doesn't exist, like my kids are going to be able to ask for help sooner. We know they're going to have their challenges as they go through. My daughter will soon be a teenager in December, and I know that they probably won't want to come to me. Why would they want to come to me for help? And that's completely cool. Go and talk to somebody else, whether it's within the school setting or and I think that's where we've got to get it. So yeah, family is a really well so big, but that's the driving force of what I'm trying to do was really my kids, because they're going to be in some tough spots in the course of their life, and the one thing I don't want them to be able to be doing is not asking somebody for help when they're struggling.
mm. And I think, I've got a 5-year-old niece, and she's got a book, and she basically, this whole book is impressing the importance of talking, and she's like, "If you don't talk, Fifi, it will get bigger and bigger and bigger." And I think it's those sorts of educational initiatives that are really, really important, and actually gives me personally a lot of hope, for kind of creating that safe space for that conversation, both between parents and children, but then also going into the wider world as you get older. I just the conversations about the guardrails has stimulated a bit of reaction on the Q&A box. So I just want to touch on upon this briefly, but I am really conscious of time. Um, Someone has written, "I'm interested in this conversation on sharing and boundaries. NDAs perpetuate stigma and stop many from sharing their stories. They can also hinder a culture of learning, increase the likelihood of toxic cultures continuing. Yet many organizations use them. It would be great to hear your thoughts. I feel technology could help to share info anonymously, but also enable a certain amount of accountability, such as if an organization is clearly using these too much due to a toxic culture and a body such as ACAS is informed with data on this." I think it's an interesting point, actually, because this is coming from, we've talked a little bit about family, but this is now thinking about the context of stigma and discrimination in the workplace, which is probably a sort of a different webinar topic in its own right. But have you got any reflections just on sort of how we look at those systemic factors that might perpetuate stigma and discrimination in the workplace? So I'll start with you, just because you may have already done some work in this area.
Not exactly in the area of the question, and thanks for the question, but we worked with 3,000 pledged employers, and quite rightly occasion that had a series of key actions that they had to create an action plan for it to be meaningful for them to pledge. And we would, it wasn't like quality control, but we would assess whether they had done those actions and ask for further progress in their plan before they pledged, as things developed. I mean, it was a very massive part of the Time to Change programme. And there was a lot of focus on workplace mental health and well-being, with our Prime Minister commissioning a big report and lots of other stuff going on. And there's lots of stuff globally with workplace mental health sort of movements. But I mean, I think the question was more about the use of NDAs and whether that is hiding toxic cultures. And I have seen a bit of the conversation about that. I mean, I don't have experience of that, but I remember when we did have a couple of pledged organisations, we had some anonymous comments, and people were saying, they might be doing that, but actually there's this happening as well. And we said, well, we're not quality controlling it, but obviously we raise your concerns, but we're not there. We're not responsible for management, behaviour and strategies. I mean, yes, it does. I mean, if digital allows people to share their stories without being identified, yes, I'm sure that's a good thing. It's like you can do media interviews anonymously, but I would err on the side of caution whether sharing something digitally can be truly anonymous or not. If you've signed an NDA, I don't know. I mean, that's probably a conversation to have with lawyers if you're negotiating. Or yes, it would be great if ACAS could look into that, because it is a shame these things do not get addressed or publicly discussed because NDAs silence people. But it's a difficult choice to make, isn't it? To take a payment or not, and then go public. Taking a payment and doing it anonymously, gosh, I think that's a conversation to be had with lawyers or ACAS. But yes, it is annoying that it silences, the reveal of some very problematic issues quite often.
I think I'm really conscious of time, and as we said, that it's such a big topic. But I think if you had one actionable thing you think that can continue to challenge stigma and discrimination and create a better world, that I think certainly if you're motivated to be on this webinar, you aspire to, what would that be? And I guess specifically in the context of digital, I think it would be great to hear both of your thoughts. And John, I'm going to start with you, because you've highlighted a number of initiatives at the end of your presentation, but it would be great to if you had one wish, what would it be?
Oh, one wish. I think, yeah, the big wish really is to remove that stigma around talking about mental health. We've seen it with physical health around different physical conditions, from cancer to even HIV and AIDS. I really want that is removing that stigma. There's no reason why we shouldn't be in a society around the world where we can talk more openly about mental health. And really just another thing around, I've kind of worked within digital and the internet and creative industries for a long time. And what's also quite exciting is there's still a lot of innovation happening. So this is a space where there's so much going on, that there's so much to get involved in. So it could be something right in your community that's really local. Sue mentioned WhatsApp groups or doing something. We've actually got more power in our hands than ever before to make a difference with people in our communities and where we live. And so I find it really exciting. So many industries you can be in and working in, you can feel like you're just churning out the same kind of stuff. But to anybody that's watching or listening to this, like if you've got that idea, find somebody else that will be your champion to support you. And yeah, the tech and the innovation is there to really make a difference. It could be just a couple of people in your street. Um, yeah, that's my wish.
And Sue, I'm sure you have lots of wishes, but if you could nail it down to one.
Okay, I would like to see more support available digitally for people with lived experience across all contexts and cultures to be able to safely and effectively share their lived experience in an effective way. We know that's the way to break down stigma, not the only way, but the most academically evidenced. And that will require resource, but so that people are not alone and on their own in the digital space doing that, because, you might have, you need to prepare even more for responses online, just as much. I'd probably say perhaps even more because of these anonymous sort of warriors than perhaps face to face, and don't do it alone. I really want people to have, my wish would be at least, a team of other champions or peers or ambassadors. And that needs funding and organising. But I would love to see that, so that every country had a group of people lived experience supporting each other and supported to disclose their mental health problems, to break down stigma, and to do that safely for them.
Thank you so much, Sue. Unfortunately, I could honestly talk for another hour, but we actually do have to wrap up. A huge thanks to our amazing panelists, John and Sue, and to our wonderful audience. Thank you so much for joining us. I think these conversations, they are so, so, so important, but they can be emotional as well, hearing people's stories, how it might resonate with your own. So I just want to emphasize to everybody on the call and to those in your life, it is always okay not to be okay. And it's more than okay to ask for help. We've obviously shared some resources in this presentation, but it really is always okay to ask for help. If you found today's session challenging and emotional, please take the time to ground yourself, look after yourself, and be kind to yourself. Thanks again. We hope you have a wonderful rest of your day or evening, wherever you are in the world. This has formed a part of a little bit of a sort of an accidental series, really, on the importance of storytelling in your own capacity, but also we've had different panelists on over the last sort of 9 months that have talked about some of those guardrails. So I'm sorry I haven't got around to everyone's questions, but through the EMIC Knowledge Bank, you will find some information and resources. Thank you again, John and Sue. It's always a pleasure. It's been an absolute privilege. Thank you. See you next time.
Bye.
Thanks very
Thank
much.
you.